Good morning, sir, and thank you for coming on board.
Good morning. Yes.
So my first question to you is, what are the most critical gaps in AYA survivorship care delivery in India? And could you share some observations that highlight these gaps and suggest solutions in AYA cancer survivorship?
Okay. A nice question, and very relevant to the present circumstances. All through we have been talking about survivorship till now and the care given to these cancer patients in the hospital. That has been our focus till now. Now the time has come that we should be thinking about the life after the discharge from the hospital. That is, I think, which is now coming up in a big way, and it is very important because we have not been thinking about the problems being faced by these children and by their parents once they go out of the hospital. So it's a very important aspect on which we are deliberating today with this August gathering and looking forward for the solutions which come through it and the suggestions which come through of this meeting.
Thank you, sir. Thank you for your response. I have one more question for you, sir.
Yeah.
Looking ahead, how can India structure its national cancer survivorship care delivery?
I think this is the way forward by having stakeholders meetings like the one which we are having here and having these meetings on a regular level and in different parts of the country along with the non-governmental organizations which would help into it and taking a chart forward where we make certain protocols where these children can come back. The Indian population or the Indian country is a vast country with meager facilities in the outskirts, say in the tier 2 cities, in the villages and talukas, and once the patient has been treated, for him coming back for treatment and follow-up doesn't remain a priority. So we have to look into how those gaps can be filled into, and one good suggestion is to use the help of digital technology for this purpose, and such sort of innovation should come, and there should be some sort of an incentive also, which I would, we have certain incentives in certain other programs where we see that patients come back for follow-up. Like I've been working with the cleft lip and palate, they come back and they get incentives. We have the leprosy patients who come back after surgery for incentives so that we can follow them up and advise them. Similarly, we can have some sort of incentives that they come back for follow-up and it takes care of their cost of traveling. And of course, as I said, digital technology should be made to its fullest use to have a good follow-up.